cancer is not the main concern that I have. I'm really concerned about sperm count and about effects on pregnancy.
How many of you know that 1 in 6 American couples is unable to have a child when they want to? How many of you know that last year the birth rate in this country dropped the most that it ever has in recent history, 3% in a single year?
People look at the sperm, and people use cell phones, and the sperm, usually sperm swim, and they swim straight. But if you expose them to radio frequency, mobile phone waves, they swim in a circle.
Studies have been done here in Australia, taking sperm from healthy men. And one test tube gets exposed to cell phone radiation, and one test tube is not exposed to mobile phone radiation. And then the results are evaluated. And this is a measure of vitality. We measure how well the sperm swim. This is a measure of motility. This is a measure of mitochondrial DNA damage. They have 3 times as much damage on their DNA if they have been exposed to mobile phone radiation. The data on that are rock solid. Cell phones can damage sperm quantity and quality.
Your embryo, your uterus in the fetus, where your child is developing for the first 100 days, in the ovaries, the eggs do not have that protection. So they are at maximum risk from radiation. And for the first month or so, you wouldn't even know you were pregnant. You wouldn't even be taking precautions. That is the main danger area. So you give birth to a daughter, but her ovaries are now contaminated. She may be normal, she may be genetically damaged, but her ovaries are at the most risk. So when your daughter grows up and she becomes pregnant and has a baby, this is where one of these eggs will be fertilized and come out. So the real damage here is your grandchildren. That is where it is going to show most.